Welcome back, Dr. Gerayli from the Spinal Pain Specialist Medical Group. Good to have you back on the program with us.
Thank you, Rob.
You know, a lot of people do suffer from back pain. You know, oh, my aching back. We hear that a lot from people. My understanding is it may not, the causes may be varied. What may make person A not feel good is different from person B. What are some of the common back pain causes?
As you know, back pain is very common. The most common cause of back pain is a very simple back strain that involves the muscles and the ligaments. Above and beyond that, we get into a variety of arthritic conditions and degenerative conditions such as degenerative disc disease, which is primarily just an aging process, and then disc herniations or traumatic injuries to the disc that at some point may cause nerve impingement, sciatic pain, and things of that nature are also commonly seen. One of the most important reasons to have a complete evaluation of your back pain is to make sure that some of the uncommon reasons for back pain do not exist. And these could be metastatic cancer from a variety of cancers that can metastasize to the bone. So we make sure that patients don't have any signs or symptoms that would suggest a metastatic lesion. And some of the other uncommon things such as osteoporotic compression fractures, which is seen again commonly in the elderly who tend to have more osteoporosis. Some congenital abnormalities such as scoliosis that patients are born with, or a variety of defects that reduce the architectural stability of the spine are also uncommonly seen but need to be ruled out.
Sounds like a wide variety of causes then of what could just commonly be said, oh, I have discomfort or pain in my back. Sounds like then the evaluation process comes in, and it's very important that you do figure out the cause as well as then think about the treatment. So the cause is important first, I guess. Absolutely,
and the evaluation plays a huge role in terms of what treatment programs patients will get plugged in. At Spinal Pain Specialists, all the physicians are board-certified pain specialists from a variety of different backgrounds. And even though we treat everything else that's related to pain aside from spine is really our specialty. Now, after each patient is evaluated by a board-certified physician, then we will enroll them in a treatment algorithm which is really tailored for their specific needs. Now, that may include a variety of exercises, physical therapy, the use of commonly used non-steroidal anti-inflammatory medications, muscle relaxers, a variety of pain medications, opiate analgesics and non-opiate analgesics, and then other treatments such as epidural treatments, various nerve blocks, and all the way to even implantable devices.
I know in the past you've shown us some of those, and they're actually devices that electronically help deal with the pain.
Right, and in future programs we'll probably go back and revisit some of those.
Yeah,
right.
Yeah. One of the big things that we hear quite often from people we know is they say, well, I have to go in for back surgery. Candidates for surgery, that might be what, maybe almost a last resort in some cases?
Usually surgery is the last treatment option in most cases. However, in some cases, patients may display a variety of neurologic deficits that are progressing. So without treatment, they may lose function. This would be the case with spinal cord compressions and things like that, where you can't really wait. But in most cases, patients do not go to surgery unless they have met two criteria. Number one, they must fail all conservative treatments, meaning they have gone through these treatment algorithms and have failed their medication regimens, physical therapy, and so forth. And secondly, they must have a surgically correctable lesion. So on MRI scans or x-rays, there must be something that could surgically be corrected. Otherwise, surgery will not play a role.
It sounds like you look upon surgery as at the end of a lot of other conservative treatments. I know some people sometimes think that doctors want to cut right away, and obviously that's not your philosophy. Your philosophy is try everything else first.
Right, unless, like I said, there is a specific reason why you need to preserve function or patients are progressively and rapidly deteriorating from a neurologic standpoint. In those cases, surgical intervention needs to be considered rather quickly.
We all want to have good care, but we also want to be able to not break the bank. Insurance. How does insurance play into with the services you provide? Does it cover some of the treatment? Does it cover some of the evaluations?
Most insurances cover almost all the evaluations and treatments. That includes Medicare and almost all of the PPO insurance plans. We are perhaps the largest provider with Monarch Healthcare. So since we're an in-network provider, all patients who are part of Monarch Healthcare, either through SCAN, Secure Horizons, or any of the other commercial plans, are also covered.
Mm-hmm. Let's talk a bit about where you're located so people that maybe need to see you can find you.
Our Laguna Hills location is conveniently located outside of Gate 4 on Paso de Valencia in the Medical Arts buildings. Mm-hmm. Our Mission Viejo office is located near Geronimo and Alicia and the Mission Hills Medical Center.
Mm-hmm. So you have really two facilities here locally, and people can find out more and get that evaluation started if they've had persistent back pain. It's not going away with some over-the-counter treatments. Might be time to see you folks and get it checked out.
Yes, we have 3 board-certified physicians at the 2 locations. We will soon be opening up a location in Irvine, near Irvine Medical Center, or the old Irvine Medical Center, the new Hoag.
Yes, now Hoag,
Irvine
right.
Medical Center, so that'll be starting in March. And between the 3 physicians, there's always availability to see the patients and evaluate them.
That's great. Well, obviously, with all 3 of those facilities, you'll be rotating around and have a chance to see a variety of patients and a variety of communities in as well. But for our folks here in Laguna Hills, probably the one near Gate 4 would probably be the most convenient.
Yes, and it's on the bus stop right in front of the building.
Right, very good. Thank you, sir, for joining us. Welcome back to Channel 6, and we'll look forward to future visits.
Great. Thank you, Rob.
Thank you for joining us today. Dr. Gerayli, again, that's the Spinal Pain Specialist Medical Corporation, and lots of good treatments and lots of good ways to make your back feel better. We will be coming right back with some more guests and more things to share with you as we continue with our program for today.